Adventist Youth Ministry inside Long Madeng Manus Mission. Once again, Adventist Youth Ministry inside Long Madeng Manus Mission. Miama mas long display afternoon lo come back lo you one time display training long helping you inside long all clubs lo you, especially inside long all pathfinder classes blo mipla na inside long master guide course na also the 7-day Adventist Youth Ministry inside long Madeng Manus Mission. Alright, lo display afternoon we just run through lo you long display first aid training blo mipla. Na me hope that by you line him something inside long display first aid training blo mipla. Alright, you look in display first aid. First aid is very very important lo you me all Adventist Youth Ministry na all church members. First aid is very important because you by enough long look out in man na you enough long saving man time and we go through long some long situations or accidents where we come up long M. Alright, you look him inside long this first aid training blah blah. The learning objectives that you may get long M. Time you complete him this session. You by enough long understanding some basic work long first aid practices. So by you now long understanding this la, by you now long applying basic first aid practices time situation Emmy allowing you. So these are our two basic objectives blah blah. Now you look him inside long this first aid where you may talk long and one of something and first aid. Now you look in definition long and first aid is the immediate and temporary care given to an injured or ill person before professional medical help arrive. So mean also time man go inside long sample kind of accident. You must hurry up long help him this man and Mary na you take care long end na while you may wait him on professional medical help loba only arrive. So mean also you got him plant in line. You may enough long save him life long all, but because you may not have a long first aid, you may make him that sample life may plan up long save him and only die finish. So very important that you must have a long first aid. Now you must also think him also inside long first aid. Objective blow me long preserve him life, long prevent him all conditions so that condition you can go back up geta. Now by me try long promote him recovery. Alright, you look him inside long display objective long first aid and we talk him also. Not necessary lo you by go school long come up with some nurse na doctor in order long applying first aid. Any one of us life situation and by placing you me long some kind condition where you enough long saving man na saving Mary. That is why the basics of first aid you need long save long end so that by enough long preserving life you can prevent him the condition lo this man or Mary lo by go bagrab moyet. Now you now promoting recovery. So this plan very important. So you can make him display first aid. One of them role or work long display or first aider. Time you face him situation, but you make him also money. Now you must act quickly, but you must also be calm. No can panic long this time, but you must fast long act. Now you must ensure that safety blow you yet, na safety blow on not man Mary too, and we must stop. Alright, time you come up long place, woman and kiss him bagrab na stop. First place something you must assess him situation. Now you must provide him the appropriate care. And then you seek him medical assistance when needed. Alright, you come back and point number 2 ensure safety of self and others. Mean also suppose somebody electrocuted or electric shock kiss him. Somebody drown, now you by go long save him. Or somebody snake bite, now you by save him. First plus something you must think him safety blue. This plus snake stop around or escaping is. This la electric shock where kiss him. Suppose you go holy by electric shock by kissing you too or not. So you must ensure that safety blue you paramount. Now who said all not man Mary too all by come stand up na look. All by come no alvin. Safety belong all too. It must be taken care of. Alright, now time this situation come up you. Now you like try long help him this man. First plus something you must think him display DRSABCD display action plan bla you long carry him out long anyone facing display situation. Alright. So you look him display letter all acronyms now only mean some plus something where you must make him. So first plus something by you make him on him. By you come up by you look danger. Action. You check for any danger to yourself, the victim and bystanders. Do not put yourself at risk. So you check him past time display danger. Now display victim where sit down and kiss him bagrab and stop. You must look long to stop danger or no god. And the bystanders, those who listen up now look. Are their life potentially at risk? No can put him you yet at risk. You check him past them danger. Time clear, then by you respond. Number 2, R stands for respond. You must check for response. You go down to the man where sleep or sleep stop. Now you must talk to this man. Gently you shake him. Now you must ask him, you are me or no God? Or name blow me Paul. Are you okay? Can you hear me? You by asking this man so that by respond. I must give you some sign also maybe harem you. Number 3 something S. S means send for help. Time you walk one them this man is that. You must call him emergency service. Get someone long call if possible. Sing out him all ambulance line all must come help or anyone got him car. By can put him money on tablo car name makes him go. A, you look him A stands for airways. Open the airway by tilting the head back. Now lifting the chin, you must check in for obstruction. Normally, time old man only say go long soak or stable this like in situation also. Some of the time you got him up kai suppose me kiss him soak and block him neck blongan or windpipe blongan or suppose electric shock and kiss him and put on the tongue blongan can block him airways blongan or some of the time or kai step kai block him neck blongan. So what you make him? You must open the airways, tilt the head backward, that is awesome. Now lifting this chin down on top and check for obstructions. And then B stands for breathing. You look, listen and feel for the breathing by taking you about 10 seconds. Look, harem, na feel him. Mane breathe or no god. Suppose no breathe normally, you by making one him, you start him CPR. Tupla big pla win by you breathing na put him on the mouse blongan na 30 pla chest compression by you make him. And this la CPR. 30 chest compression and 2 breaths. You must repeat him. Alright, na D emolan long ausik oli sabe kam na olet oli by making this la. Alright, so time you look him victim and syllabus step, you must think him DRSABCD and action plan below you. Alright, something for you that you must take care of you yet, na take control of the situation. Number 1, you must stay calm, na take charge. No can panic, no can look for somebody else. Alright. Then number 2, you must approach confidently. Now you introduce him you yet. I am a nursing officer or Miss Avelo First Aid. Me can help you. And reassure the casualty and the bystanders. Talk him all and by alright. Talk him Sloman and Simbarab, you by alright. You relax, remain calm, breathe normally. Now you communicate one to me. And then number 4 is to delegate. You delegate him this task. Ask someone to call for help. Call housing or finding money at him vehicle so that them can help him. Okay, the last is avoid panic. Now clear communication is vital. No can sing out you come na ayo mi plano na by that. No. Avoid panic. Now you must be able to communicate clearly. That is vital for survival. Alright, time situation and become able. You must come and assess him environment. You identify him assets. You look him traffic, plan the car running, come fire, no good fire cooking, electricity. Look for things that are of potential danger or harm that could further harm you and the victim and the bystanders. Move the person only if absolutely necessary. Suppose spinal cord blongan emi dislocate or emi broke. Suppose neck blongan emi dislocate or emi broke. Lo displol samplol instances by not long movie mem and by needing all specialized line long ausik or let by come na deal one time all display kind line also. Alright, number 3 or last blood log this lab and to ensure scene safety before administering aid. You must make sure condition am rightly. Safety blue is guaranteed. You establish like a culture where some of the time you handle him man as I was saying bagrab all batos and you tasol working and die. So fight by come up, cross by come up, compensation by demand by come. So you must look in that safety blue am you right, then you administering aid. Right. You got him sample specific conditions where you in up long applying first aid long. Number 1, and bleeding. Bleeding and come up. Time bleeding and come up, you must apply firm pressure with a clean cloth. Some of the time you must have a kai daka, you may put some like maybe kambang, you may put some like leaf and tap long this place where bleeding and come up long. But you mean like him eye long this fresh cut and you must be clean time I'm go so that all by sum up him or kind of thing. So you must apply firm pressure one time one black clean black cloth, put him on top and put him pressure long. Alright. Number 2, elevate the injured area if possible. So some cut him hand long, up him hand long. So some cut him leg long, up him leg long. Do not remove embedded objects. Apply pressure around them. Suppose one man only suiting him lo spear, only suiting him lo wire caterpillar, only suiting him lo fishing gun wire. You know can come out in this wire, you know can come out in this spear, you know can come out in any object while suiting him long. But around long this object, you must apply pressure like the donut. Applying pressure long and bleeding. Alright, you look in bends. Bends have come up. Alright. Instruction blue M long call him this bend under the running water for 20 minutes. Alright. For 20 minutes you put him underneath the water. Then you up him can. Then you apply him can. Do not apply ice. No can apply him ice, no can apply him creams. Now you no can broke him blister. This bla am tumble. You stop almost kilometer away from the hospital. Do not break the blisters. Kisimem kam la ausik olen lausik ba alibimem. Cover loosely with sterile dressing. Suppose you got him this blood sterile dressing, then you can apply him. Now you can cover him this blood bands. Alright? Now you look in this blood choking. Choking him sabe come up. Samlata you me hungry na you me hare pare block kai or samlata time ting blue me stalo narblab na you kai go pass lo neck. By me make him on him. Number 1 something. Encourage him this blood man or Mary or victim. Long I must cough. I must cough so that I by cough him out. This plus something when block him neck block. Number 2 something. Suppose I'm not able to cough him out by you performing back blows up to 5. You bite him backside blow and 5 la time, followed by abdominal thrust up to 5. And here you look at the picture. 5 la time by you bite him long backside blow and now 5 la time by you put him and go along this la rib cage blow and now you up him 5 times. So that this is something and block him mouse blow or neck blow and can shoot come outside. Alright, last point. You must repeat until obstruction is cleared or person becomes unconscious. That is about choking. Time I'm unconscious, by put him in the recovery position and by sleep. Or suppose I'm pull him in, by you must tilt him head no go on top, look on the mouse blongan, rouse him tongue blongan, or suppose you not looking for the donut and pass the throat blongan, put him and go down, rouse him. Now you apply him CPR blongan. By me come no recovery position, now by me come no CPR, by me explaining. Number 4, suppose fractures and sprain and come up. Man me run or man me walk about na leg long and somehow me well na sprain and me come up by you making one. Alright? Number 1 something. Immobilize the injured part. There's the part where me twist long and me broke long and you know can move it. Alright? you must apply him ice. You wrap him ice lo cloth na put him on top longan lo reduce him swelling. Okay, do not try to realign bones. Suppose bone longan na mi abrus na stuff. You no expect long bone. You no sabi long olim bone blol man. You no can try to realign him by you bagrap him this man. Alright, and then you seek medical help. Seek medical help. And then you come along this man where shock and kissing him. By you make him on him man. Okay, lay the person down with legs raised unless injured. So you lay this man down. Want a leg long, you raise him water. Okay, keep them warm and calm. Do not give food or drink. Now you seek urgent medical assistance and shock and kiss him. Alright, so raise him leg long water, keep him warm and calm. No can give him kai or drink. Now you find him medical assistant. Long help him this man or Mary. Okay, seizure. Seizure, talk pisin samla time talk sick muruk am kisim all man on slagan. Or samla something am come up na all man think go no na all just go all go unconscious or slagan by you on him. Seizure. Seizure am sa come up lo this lo line we got him sick muruk, you miss a look him this la. All no can go was so yet, you must be animal. All no can climb him the all yet, you must be animal. Is a got him sample sign, all is have a so him lo indicate him also. This la seizure am lo come now. So you must wash good long all this black kind line. Nungo dol pudan lo fire, na fire cook him all die. Nungo dol pudan lo water, na all by drown. Nungo dol pudan on top lo big la diwa come down lo giran all hit him all let all by die. So you must protect him all. So protect the person from injury. So you must move him edge, protect him. Do not restrain or put anything in their mouth. No can try and push him spooning on the mouth long and by you bagrab him teeth long. MCJ. You just put him in the recovery position. And then you must time him this Lord seizure long. How long am I come on? I must minute am I come on. After the seizure, place in recovery position. And money am sleep and recovery position. Place him in the recovery position now and by sleep. Until this is something and finish. Alright. Then also you may look him unconscious but breathing. You got him some line all is unconscious, but all is have a breathe. But you make him on him. Place him in a recovery position. Now you must monitor him breathing. Na pulse blongan, heart blongan na mi pump. You by put him hand long, neck blongan na you peel him, or you can put him long hand blongan. Now you can peel him this na. Now you must monitor him breathing. Na pulse blongan. All right. Now continue long reassure him. Now wait for help, medical assistant by come. There is also this plus snake bite. Long first aid, but you make him want him something looks like that. Number 1, stop him all get a movement long body blood disploma. Na lo leg where snake em kaike long no an where snake kaike long no can through moving. You sabe, you got implant the line you mean up long save him all where snake em been kaike more. But because you may panic na you may moving all go come. Poison na me moving on the body na you on the heart na man me die. As soon as you find out was a man snake and kaika man, no can move him this la man. Now you ring him, how sick lo me back on. Number 2, by you make him on him. Alright, you must apply him this blood pressure bandage from end upwards over the bite. You start him down low, you come on top the place where snake and kaika line. Karma him this la bite, place where snake kaika. And number 3, splint the limb. You put him this sticky go. Now you pass him number 2 banis and tablongan. So that man no can move him leg and blongan. Place where snake and kai blongan. So I must keep completely still. Now number 4, kiss him go long. Housing. Some more instruction about him snake bite. Number 1, something by you make him on him. Follow DRSABCD. Look for danger. If the snake am stop yet or am go finish, then you help him Slaman. You go na talk longan, fill him, suppose Slaman am respond, call him name longan, send for help, ring lousik. You check him airways longan and continue to breathe or no cut. Na breathing longan. Na suppose him no breathe, but you apply him CPR immediately. Number 2, call emergency services immediately. Number 3, keep the person completely still and reassured. limit all movement. Leg no can move. You may not have movement number, you must limit him all this. Alright, number 4 times snake bite by me make on him. Applying the pressure immobilization technique. By you make him also on him. Place him abroad 10 to 15 centimeter firm elastic bandage directly over long display bite. Put him banis on top the place where snake kaikamem. Then you apply him a second bandage over from fingers or toes up towards the torso, covering the whole limb. Number 2, you splint the limb, including joints, on both sides of the bite side to prevent movement. Put him stick, now you pass him both sides. And then mark the bite location on the outside of the bandage if possible. Place where snake you put him marker on him, now you mark him. Number 5, take note of this. Do not cut. Place where snake no can cut him. Inside, no can try and open him lick this blood long, let him blood back come out. No can wash him no water. You no can put him mouse ego or one him kind straw, no try and suck him this blood wound. No thinking that by you pull him out this blood poison. No God. By you bug rubbing you that. And apply a tourniquet that stops circulation. Alright. Number 6, long snake bite. If the person may collapse or becomes unresponsive, then stop breathing, start CPR immediately. You look in this picture here, Mary applying CPR. Alright, long before also we're talking about CPR, I'm also you by you walking mouth to mouth. Today, only tambo mibla long this because some only got him sick, also TB, some only got him kus no good. Some line look like a boy and a mouse longo let me healthy lo me put him mouse go longan. So this like kind. So you got him this like gumi and stuff. You by kiss him like gumi na true lo this like by you breathe go. So you know can catch him. Suppose I'm got him all STD sickness or I'm got him some like kind of sick when carry him around one time. Alright, so that's about snake bite. One time by you call him help. Lo time first aid you like apply him lo man. When? Always call emergency service when, number 1, the casualty is unconscious or unresponsive. I mean unconscious, I mean no respond. There is severe bleeding or suspected internal injury. Bleed them continuously bleed. Now you suspect them got him internal injury and stuff. Alright, number 3, a seizure lasts for more than 5 minutes. Now I mean repeat. Okay, this is like you must sing out in emergency. Help must come. Number 4, and breathing is difficult, long. Okay. So breathing difficulty is okay. And pulling when you go and moklo struggle long pulling when you must call him emergency. Alright, last blah, there is suspected attack or stroke. Attack and by come up or stroke and by come up. So lo this la time you must call him emergency area. Alright, you talk na you cover him something and talk about him recovery position. Recovery position, but you make him also man. Alright, you look close like picture. You kneel beside the person. Place him this nearest arm long end at the right angle. Arm long end where I'm stop close to you, lo leg blue or lo side blue, yeah. You put him at the right angle. Amen. Or amen. So you put him at the right angle. Now you bring far arm across the chest. Narblania, you pull him also the chest, placing back of hand on the cheek. And bend funny, up roll the patient towards you onto their side. Adjust the head, tilt to keep airways open. Number 6, that is the recovery position. Alright, you look in this recovery position here. How about you make him? Number 1 something, and you look at the man lo red set here, put him hand don't come on top underneath the chin long. Number 2 now, up him the leg long, you may push him over and then you may let him sleep. That is the recovery position. How about you make him? What is the purpose of the recovery position in long first aid? Why you may make him this? Number 1, maintaining an open and clear airways. Okay, maintaining now opening this clear airways. It helps prevent the tongue from falling back and blocking the throat, especially in an unconscious person who is breathing normally. Suppose tangem like puran go back, nami puti loris la recovery position, and by mane sleep good. And we prevent him choking. By placing the patient on their side, it allows fluid like saliva, vomit, or blood to drain from the mouth, reducing the risk of aspiration. Alright, number 3, and we promoting safe breathing. It supports normal breathing while waiting for emergency services. Alright, and stabilizing that patient. It helps keep the patient still and in a safe position without requiring constant support. Alright, so take note, the recovery position is only used for unconscious people who are breathing normally and have no suspected spinal injury. Okay. Why is first aid so important? First aid, why is it important? Okay, we can save him lives. Number 1, something. It can help save lives. First aid can help you attend to a casualty, relieve their pain, and prevent the injuries from deteriorating. Number 2, it can help you spot hazards. First aid can help attune your sense to identify and minimize potential hazards in the home and workplace. Number 3, it is convenient. Our courses are held nationwide, 7 days a week, and we can even accommodate group bookings in your home or workplace. Okay, it is convenient. Alright, you must line him this lesson. Please take note, lo this la basic first aid kit. You must get him lo 1 workplace na long church too. One or something by stabbing lo this la. You look him la bunnies and we must have bandage, adhesive bandage. Now you must get him all gauze pads na tape. Anything in your pen, but you need him all this la pads na tape. Now antiseptic wipes, scissors na tweezers, na CPR face shield, gloves, pain relief medication, and emergency blanket. This is all something and we must have. Stand by a long emergency. CPR and one something. CPR, you may call him also cardiopulmonary resuscitation. So CPR is a life-saving emergency procedure used in first aid when someone's breathing or heartbeat is stopped, such as in cardiac arrest or drowning situation. You must have applying this CPR. Why is CPR important? Okay, and we keeping blood circulating to vital organs, especially the brain, and we increasing the chances blow you long survive. Now it buys time until the ambulance or medical assistant and we come up. How by we come up in this or performing this CPR? Number 1, you ring him online lousik. Number 2, lame this man or Mary or victim lo backside blongan. Now you tilt him head blongan you want to open him airways. Okay. Number 3, if they are not breathing, you start him CPR. Number 4, you press him chest blongan 30 time. Na you by you pump him wind blue gonzalo this man 2 time. Number 6, repeat until ambulance and come up. Now you can bring him and go out sick. Alright, you look in CPR. Or CPR inside lo adults na or lik pignini. By me walking also man. Number 1, you place him on blue long center long bros blue display man. Now you lock him finger blue water. You use him body weight blue long push hard with your hands. Now you keep pressing at a rate of 100 to 120 beats per minute. Number 4, do chest repeat compressions followed by 2 rescue breaths. Now you repeat long display. Alright, and long all big man blow piginini by me CPR for children and infants. Okay, for children, use 1 hand for children 1 to 8 years old and 2 fingers for infants. Infants and 2 finger by you pressing. Now this plan we 1 to 8 years old and 1 plan, 2 plan, 1 plan. Compression dipped, how far by you pressing this plan chest long about 1/3 the depth of the chest. No can press him strong, 1/3 of the depth. Ratio and still 30:2 for single rescuer. And piginini or I'm big plan man and baby also or I'm big plan man. Still by you palm him 2 winning on side, na 30 time by you pressing bros man. Alright, now this is the first aid. ino blo one blo man merit sol. First aid and blo organ line. It doesn't require medical expertise, just a willingness long halibe mol man meri. You must practice regularly. Now you must keep him knowledgeably updated lo first aid. Now you must always seek him medical follow-up after you administer him first aid long ombla man or ombla meri. So first aid is very important. You must save life. So be a hero, save life. First aid is for everyone, everywhere. Alright, thank you Olgeda. Now I hope you learned something through long display first aid training Romibla. Thank you straight.